You're on your weight loss journey on Mounjaro and Wegovy, and you feel really tired. A tiredness that's making your bones ache, and you've realized you're getting sick more often as well. It might be vitamin D deficiency. I'm Zainab, I'm the pharmacist from Pills Sorted, and I'll explain why vitamin D is so important, how do we measure it, how do we treat it, and what are the different options that are available out there. Vitamin D is essential for your body to be able to absorb calcium and make use of it. As you know, calcium is a lot in our bones. When you don't have enough vitamin D in your body, the calcium and phosphorus that you're eating doesn't get absorbed. That causes the parathyroid gland to become overactive, and both low calcium and high parathyroid causes muscle weakness, muscle cramp, and pain in your bones. When there's a hyperactive parathyroid, it starts snatching the calcium off of your bones to compensate. And that's why the bones become weaker. In children, vitamin D deficiency is called rickets, and it shows itself with bowed legs or bent bones. The same can happen in adults, and it's called osteomalacia. It's got a huge effect on both our muscle strength and our bones. When we're trying to lose weight, vitamin D is actually soluble in fat. So when we're overweight and obese, the vitamin D gets stored in the fat cell. So it might be that you've got enough, but it's not available for the body to use. So your body is left with low vitamin D. And when you're losing weight, that is not enough bioavailable to compensate with the deficiency. That's why taking vitamin D and making sure that you've got the right amount of vitamin D in your body is really important. Now, the other thing is when you're trying to lose weight on DOP injections, you've got a very suppressed appetite, you might not be eating enough, and that is not going to help fill in the body's need for vitamin D. So that's why it's so important to make sure that we get the vitamin D right. So how do we understand? A simple blood test is the way that we find out if we've got enough. It's really important because 1 in 5 adults in the UK have been identified with low vitamin D, and the NHS advises for everyone to have vitamin D supplements for the winter and autumn seasons. And why is that? Because sunlight is one of the important ways that vitamin D gets absorbed in our body. For many people, actually, the NHS guideline is to take it year round, because that absorption by sunlight can be very different person to person. So in elderly people, with darker skin, the absorption is much less. That's why it's so important to talk about vitamin D. There's a lot of deficiency out there, and that's the current health advice about it. If we've been diagnosed with low vitamin D, there's 2 important kinds of vitamin D. One is D2 and the other one's D3. D2 is a plant-based vitamin D that you can find in mushrooms, in a lot of fortified breads and cereals. You've got that vitamin D as well. There's vitamin D3 or cholecalciferol. That is the animal-based vitamin D. The absorption is much better and faster, and it's in eggs, oily fish. Make sure that you've got a lot of these in your daily diet. What's the difference between cod liver oil and vitamin D supplements? So cod liver oil is a very good source of vitamin D. It also includes vitamin A, and it includes omega-3 fatty acids. Okay, it's really helpful for joint pains, for reducing the inflammatory markers. However, if you've been diagnosed with vitamin D deficiency, it's really important to take that amount of the vitamin D that you need. So not all of the times cod liver oil can give you exactly what you need in the vitamin D. So I'll explain what's the daily recommended allowance for it and all of the different strengths. But that's the difference between the cod liver oil and the vitamin D supplements. There's lots of different types of vitamin D supplements. So there are the tablets and the capsules. They've got, the higher doses usually, and they're easier to take. The important thing to remember about vitamin D is you eat it after food, because any fat that's in the food can help the absorption of the vitamin D. So don't take it on an empty stomach. If in some patients we're worried about the absorption, so people who've had bariatric surgery, elderly or they find the tablets and capsules uncomfortable, there are sprays. So the spray can have an absorption through the mouth and it can work effective too. There's drops too. So drops are used again for people who find it harder to swallow, like children, like some elderlies. So you can have them in drop format as well. The recommended daily allowance is 10 micrograms per day or 400 IU. If we have had a blood test and we know there is a deficiency, there might be given a loading dose. So a loading dose can be different formats. If it's a daily tablet that's been agreed with the doctor, it can be a daily tablet that's a higher dose than the 10 microgram, or it can be a even monthly dose of 50,000 IU. So there's lots of different ways that we can make sure that we get this loading dose started, and usually it's a 6 to 8 week plan, and then it will slowly be reverted to the daily dose of 10 micrograms or 400 IU. So the amount of vitamin D that you need can be confirmed with your doctor. Okay. Other than the different types of vitamin D that you can get, there are lots of combined vitamin D with other minerals. So for example, there's vitamin D and calcium that we can give, like Calci-Chew, like AdCal. These would usually be prescribed for people who've got osteoporosis, because it can help make sure that we've got the right amount, or people who are elderly, who've had osteoporosis, who've been on a long-term chronic condition and have taken medication that can affect the bone's absorption of calcium, like steroids, will be given the calcium and vitamin D. Now there is the vitamin D plus K2 as well. This would be helpful for older adults and for women in their menopausal time, because it can help direct the calcium absorption in the body. So with vitamin D and K2, you can get the absorption of calcium more in the bones where we want it to be. And there's another one as well with vitamin D and magnesium. So sometimes when vitamin D by itself doesn't help replenish enough of the body's levels, so after a couple of times we see the vitamin D is still low, adding magnesium can really help, because magnesium is needed for the vitamin D to become active in the body, especially if there are symptoms like muscle twitches, muscle cramps. Adding that magnesium can have a better effect in improving the vitamin D absorption. As a recap, vitamin D is super important on your weight loss journey, especially for protecting your bone strength, your muscle strength, as well as keeping up with your immune system. If you've got any questions about what's the right supplement and how to take it, feel free to visit our website, subscribe to our channel for the best clinician-led health advice. Thank you.